everyone. So good evening. I'm Dr. Tiffany. We're going to be going over home care, how to use it, how to troubleshoot it, and any questions you might have about your home care tonight. So I'm going to get us started off with the cervical roll. Cervical roll is a foam roll. It is this foam roll. It is used to support your cervical spine while you sleep and promote that smooth C-shaped curve that we're trying to attain with your care here. So we're going to show you how to use it with Amber here. Go ahead and roll out. You want the cervical roll to be right at the bottom of your neck, above your shoulders, and you're going to lay on your back. So the reason we lay on our back, there are not spine-specific reasons we sleep on our back. One is for beauty. When your face is smashed up against a pillow, it creates wrinkles. And dermatologists can actually tell which side you sleep on based on which side of your face is aging faster. So I thought that was interesting. Another benefit is that your arms don't fall asleep and your shoulders don't hurt whenever you're sleeping on your side or with your arm up. So sleeping on your back is the way to be outside of your spine. When you are sleeping on your side, that encourages rotation in your spine, so in your thoracic spine and in your lumbar spine. No one can sleep on their side perfectly straight. You kind of curl up into a fetal position that it decreases your cervical curve. So we're working against what your posture trainer and your head weight is doing, which you'll learn later. And it,
So are all the bed commercials lying to us then?
about what?
All the bed commercials where they show people sleeping on their side and they draw a straight line down.
Yeah, absolutely. So I don't know if you've seen the promotion for the pillow cube recently, but that's the newest pillow invention to help you sleep on your side. And it's supposedly a square pillow that you put next to your head and it supports your head and keeps your spine straight. I still argue that's not really working for you because your lumbar spine is still going to roll forward. You can't sleep like a plank through your whole night. But the idea behind this is we want to support our curve. You want to be working for your spine for that 1/3 of your time of your day rather than against it. So, to get started sleeping on your spinal roll, it takes a little time. We don't want you guys to lose sleep. Some people can jump right on it and sleep on it all night, and that's great. But others, it takes days, weeks, maybe even months. So we recommend that you start out sleeping on it or laying on it right before bed, and then work up to falling asleep on your roll, and then work up to staying on the roll most of the night. And then eventually you'll get to a place where if you wake up in the middle of the night and you've turned over or your roll is not underneath your neck, you replace it and get right back to sleep. It's a process, but you can do it and be comfortable sleeping on your spinal roll. So like I said, compress it, place it at the top of your shoulders, and then lay flat on your back. You don't want it to be too high because then it's pushing your head forward, and we run into the issue with conventional pillows. That forward head posture is what we're trying to work against. Okay? Did I miss anything about cervical roll?
It's probably, of all the equipment, as anybody knows, that's probably the hardest acquisition time of all of them. The most consistent thing that we hear as doctors with the home care is when we get to an exam and with a re-x-ray, you can normally look at a re-x-ray and tell which home care they're not doing, right? And so a consistent question is, so are you sleeping on your neck roll? And the most common of any of them is, I can't sleep on that thing. And you find out that they've only tried, for a week, something like that, and then just went back to their pillow. Or the mistake of having the pillow on the bed. And as I always explain to them, like, if you're a smoker and you're trying to quit smoking, you're not going to as long as it's in your purse. Like, you've got to get rid of the pillow on the bed entirely, because that's the only way you're not going to, most people, once they're laying down, they're not going to get up and go to the closet on the other side of the house and grab their pillow in the middle of the night. You'll just deal with it and you'll get used to it. So once people make the switch, then
and I'd say
it's
that
easy.
Getting started too long, trying to sleep on it the whole night is the hardest part, even if you have to lay without anything underneath you. trying too much too fast is where you get discouraged, and then you just don't try again with your cervical pillow.
I was gonna add, we spend a fourth to a third of our life asleep, in bed, or we should, so 6 to 8 hours a night. It's probably the most beneficial in my opinion, because we use it for so long. We should be using it for so long, versus like a head weight, for 20, 40 minutes a day, or the posture trainer for a few hours a day. 6 to 8 hours every single night. Good therapy.
Yeah. And one more note too. What makes is every neck roll the same? Because sometimes people will say, that they've got another pillow, that they wad up into a roll, and stuff like that. And sometimes that's fine. If you've got a really thin pillow and you wadded it up, or honestly, in some cases, people's necks are very, very small. They have the short necks, and so as a result of that, the roll seems too big. So we have them put it into a tube sock, right? But when it comes to how we determine that roll, we DMX tested many people on, I bought every kind of roll I could possibly find. I tested everything that I could find on the market, and everything on all of the major sites, and tested all of them, and until we found the one that was comfortable enough to sleep on, but actually maintained the curve of your neck. That wasn't so small or so squishy that it didn't do anything to support that curve. So you have a range where it's either too flat or it's too big. It was trying to find that midway in between. But not everybody's neck is the same size, so sometimes you have to make those adjustments accordingly.
So then the last bit of information about the cervical roll that I have is to make sure you cover it with something. This foam is very attractive to hair, and it's especially pet hair. So put a pillow over it, a tube sock if your neck needs a smaller roll, and just make sure you keep it covered to keep it lasting as long as possible.
Standard pillowcase is fine.
And that's how I do mine. I roll my pillowcase around it to compress it just enough that it fits perfectly underneath my neck. Okay. Y'all have any questions about the cervical roll? Pretty cut and dry. Okay, so we'll move on to the wobble disc.
The only issue I've had is we've been doing this a couple of weeks, and we've switched. She actually took our pillows off the bed, put them in the attic. They're gone. So I'm sleeping with it, but the issue I've got now is I'm okay with the neck, but if I lay completely flat on my back all night long, I wake up the next morning, my back hurts.
My
lower back hurts.
So you will want to elevate your legs slightly to keep the support in your back. What's happening is your pelvis is rolling too far forward probably, and that is increasing the curve so much so that it kind of makes it ache down here.
Okay.
Okay.
But a lot of times that'll go away as we get going too. That might be, that's not in other words, that's not something that everybody deals with. You know what I mean? So as we're dealing with the postural issues from the chiropractic side, that should also improve.
Okay.
It's definitely not normal to have back pain sleeping on your back.
Yeah.
Okay. So onto the wobble disc. Each region of our spine, cervical, thoracic, and lumbar, has its own different values of range of motion. And I don't know if you've ever heard the saying, but movement is life. A lot of patients get into the office and start doing their wobble exercises and remark that they didn't realize their range of motion had decreased so much. They start, especially rotation. People will turn their neck and they stop here when really you should have 80 degrees of rotation in your cervical spine. And they're like, wait, that's not normal. I have to turn my whole body to look behind me. So this is a very valuable tool in getting motion in all of those ranges daily so that you can maintain full range of motion for a long time. So the outer part of your vertebral disc is called the annulus fibrosus. This part is the protective part of your disc. There's a gelatinous inner cushion inside that called the nucleus pulposus. Your disc hydrates itself throughout the day with motion, and then as gravity works against you, it compresses that disc and presses the water out of your disc. This exercise is meant to help get the motion in the joints, also rehydrate those discs with that motion. You also work on balance and core stability with this exercise. and Amber's going to demonstrate how to sit on the disc. This might be a little tall for her.
But it toes.
It's also good though, because she can still contact the floor.
Yes.
You want the disc ultimately to roll your pelvis forward just a little bit so that you can support that lumbar curve. And then we're going to start with the flexion extension. So she's going to arch down in the front with her head all the way down forward, pelvis rolled back, and then all the way forward, head all the way back. So you're getting the full motion in the spine. Good?
And then what about speed? Because patients get confused.
Yeah. So it shouldn't be a very, very fast movement, but it should be a fluid movement. You want to move into flexion and extension. Yeah. So don't do what he does. You want to move into flexion and extension fluidly, but not too quickly so that you're dizzy or falling off. So this is not a race for your wobble exercises. Okay. So, and then I want to point out also that flexion and extension is one motion. So when you perform this exercise, depending on which care plan you're on, you will do 30 or 100 of each of these. Okay. So now we're going to do lateral bending. So Emma, go ahead and hold your arms up for me. You want your arms up at shoulder level. You're going to lean to your right, bring your right hip up, right shoulder down, and then your right ear toward your right shoulder. So she has this nice curve all the way on one side. Okay, so then go to the left. Good. Same thing on the left side, that's one repetition. And you're going to do 30 or 100 of these as well, and a nice fluid movement. The big thing is to get the head into that motion so that you're getting the motion in your cervical spine.
A lot of times, especially here when people are doing therapies, right, they're watching what's on the TV. So, you see people doing this,
Yeah.
And their head's not really into it. So, you kind of have to just watch TV crooked.
And then we're going to do rotation, so you're going to have your arms up again. We rotate all the way to the right. You don't really want to move your hips. You want this to be all lumbar, thoracic, and cervical spine. And you're going to turn and look over your shoulder too, and then all the way to the left. So really include the head in that motion. Okay, great. It's important for these that your head is upright. You don't want to be looking down while you're doing these unless it's in the flexion portion of the flexion extension move. And you don't want to have your pelvis rolled back either. The important part is good posture while you're moving through these motions, because we don't want to train your brain into bad patterns. So it's good to be mindful of that while you work on that. Another really important aspect of this is CSF flow. Cerebrospinal fluid is a fluid that bathes the brain, spinal cord, and the nerves in your body. It provides nutrients to all those structures, and it removes waste. So whenever we have decrease in the cervical or lumbar curve especially, that CSF flow is interrupted. So this is a good way to get motion in here and help that CSF move. So we use this twice per day at home. Really, there's a limit on that. You can use it as much as you need to. I've heard of patients who were having disc issues and used it more and saw faster improvement with that. You can also use it to sit on your chair, since it does promote core stability. That slight balance control that your body has to do works for you throughout the whole day. Okay? The one thing we want to troubleshoot with this item is that you want to place it on a firm surface. So you definitely don't want to use it on like a mattress or a couch, because you want to have the stability underneath that so that all the wobble comes from the cushion itself and you're not sinking in. Any questions about that? Did I miss anything?
One addition on inflation of the disc. We give ours to you guys already inflated, so that's right. But we'll see videos of on YouTube and stuff in chiropractic clinics, and they've got these air discs literally blown up like balls, but they're discs because they're supposed to be discs, right? They're not supposed to be balls. They shouldn't be like this. That's overinflated. In fact, like the sides actually buckle in when you blow it up that much. So what you should be able to do when you have it inflated right, you should be able to push your fist down on one side of it, and it doesn't bottom out, but it should barely go to the bottom, like almost touching. Does that make sense? So as you push down, you should almost be touching the bottom. If it's overinflated, you can barely push it in. I mean, you could play volleyball with it, right? And then of course, you're supposed to sit on the smooth side. I guess you could sit on the
Yeah,
pointy
for a
side.
little
but-
sensory input, but I don't want that.
Pressure. Yeah. One more thing, because you guys notice we use the other chairs here. We don't use the disc here. Really what that comes down to is the size of the pivot points, okay? The wobble chairs, those are Pedavon wobble chairs. They sit literally on a single tiny point like this, right? So you do get a better pivot range on those chairs. Whereas a wobble disc, these have a much wider point on them. Same thing if you were to go to a giant exercise ball, right? That would be even a bigger pivot point than this is. So the larger the pivot point is, the less your pelvis is able to move side to side. So, you might only be able to get this much motion on a big ball, but your pelvis can get almost full side to side sitting on top of the pivot. Make sense? So the reason why we use these for home care is they don't cost $150 a piece. So
Yeah,
people,
much easier to take this to work
Yeah.
with you if it's not that huge clunky wobble seat.
absolutely.
Well, I'm gonna turn it over to you.
Any other questions on those two? No? Excellent.
My cheat sheet. So guys, in just a minute, I'll be going over the head weight and the horizon glasses that go with them, and also the pelvic blocks, which not everyone gets, but if you're one of the lucky ones with enough pelvic tilt, you'll get these blocks as well. But I want to start first, before going into the head weight and horizon glasses, as the first piece of equipment, talking about something in the brain called writing reflexes. And I'm glad we did this workshop now, because I needed to kind of catch up on the literature and stuff that Dr. Mike's given about all the therapy equipment in the office. And when he suggested this topic, I jumped on the opportunity to take the head weight, because that's the one I least understood before this workshop. So with the head weight, the body has something called these 5 writing reflexes, and what they do is they're responsible for keeping the head on the center of gravity. And it's like any other reflex, you don't have to think about it. You don't have to think about your heart beating, or like if someone were to take a hammer and hit your arm or your knee with kick, you don't have to think about that reaction. You just do it. Your body has a reason for that. So if you begin to slump forward or sink out to the side, you'll be off balance. You'll fall easily. I mean, the brain's purpose, or the whole point of the rest of the body besides the brain, is to carry the brain around and to interact with everything in life. The brain interprets and has an appropriate response. So if you think about carrying a briefcase, or one strapping a backpack, carrying a purse with one side, any one-sided, we call them micro traumas, or actions that you do pretty much every day. The act of picking up something heavy shifts your center of gravity. You're now carrying an additional weight. Usually we engage the muscles up here, the traps, pick them up. As a result, we're going to also shift left to pull the center of gravity over here, and the head's going to come back as a result. So we're now carrying something. If you're one strapping a backpack 5 days a week for an hour a day, you start to set in a new pattern and a new normal for your body, because you've activated this writing reflex and to keep your head on where it needs to be. And it's interesting because these reflexes and the innate organizing energy that's in our body does this without us even thinking. So we can use this to our advantage, or it can have detrimental effects. And another thing is macro traumas. So if you're involved in a car accident, or have a whiplash, if you're playing, football, high schoolers, burners and stingers, hitting from the side, if you have a jarring accident, the body's not just going to keep you here. It's going to stick the head upright and adjust everything below. As long as the head's good, it'll sacrifice the rest of the body. So macro traumas can also be a cause, I'd say a little less common than our day-to-day carrying wallet in the back pocket kind of deals. For men, it's usually wallet, utility belt. For women, and for men also, driving with the same arm, hiking up the other hip. For women, purse, backpack. We all tend to have our things that we do one-sided. But so muscle below the spine will displace until after enough time has passed, the soft tissue structures will move as well. So carrying this briefcase day to day, you'll start overextending, lateral flexing these on the left, and you'll tighten these on the right, the ligaments. Now you have no new normal for your posture, and until it's addressed, it's just how your spine is now. So when we take our initial X-rays and we see like, barring it's like a scoliosis that you're born with, if it's just 10 degree, and then the head's on right where it needs to be, you're like, how did that happen? Well, it's these micro traumas or if there was a macro leading up to it, and now you have this is your new normal. And addressing the forward head posture. Now it's all from the side with the shoulders and the hips and everything, but the forward head posture, there's 3 components to forward head posture. It's, we say the head going forward, but just as important as with that is the mid-back going back. So because we're trying to keep the head on the center of gravity, out here would not be the center of gravity. We need some changes below. So typically we slump the thoracics and then the head comes forward as a result. With that, we also have the picking up the head to look at the horizon, which is pinching of the atlas and occiput in the back there, and loss of the cervical curve. So the curve in the neck tends to suffer as well, and it puts a lot of strain back here right above that bump that everyone has at the bottom cervical vertebra. And it's like holding up the weight of a bowling ball, your head essentially. So can be anywhere from like 12 to 18 pounds, maybe more. You want to hold a bowling ball straight up and down. You know, you won't tire out too much, but when you start slumping forward, these muscles back here are really going to suffer. And same thing with your head. The more you slump forward, the traps back here are really, really not going to like it. They're going to fire up. They're going to have to brace and hold you, from slipping too far. But eventually they will loosen up. Soft tissue structures will change, and you'll have a new normal out here. But with loss of the cervical lordosis, another thing to mention is you have up to 30% loss of diameter in the spinal cord canal, or spinal canal, and also the nerve roots themselves get compressed. So the further we elongate, if you think about a hose, if you were to pull the ends away of a stretchy hose, it's going to narrow out that canal. Same thing with the spinal cord. And with cerebral spinal fluid, the nutrient-dense fluid that bathes all the nerves, keep them happy and healthy, it's important to have that diameter a little bit wider. Narrowing that's not a good thing. And there was another workshop where you actually addressed a common thought nowadays for fibromyalgia is potentially these nerve roots not getting enough nourishment. So that was kind of interesting to me. And there's more and more research pointing now to that as a cause of fibromyalgia. So kind of interesting. But that's everything that can get you out of place, everything wrong with forward head posture. Now, to address it, we have to put in a new knee. Think of it as a backpack, but for the front of your head. We're going to increase the force of gravity on the front of the body, where the head is, and it causes you to have to actively pick up to pull back the head over the shoulders. Pair that with the horizon glasses, and it'll keep you from tilting the head too far. It'll pick up the head where you need to be. You want to come up and wear it?
While she's getting dressed here, one more component with the riding reflex is the forward pelvis, because part of that, your head will always stay positioned over your pelvis. Or another words, the better way to look at that, based on what he was saying, is the head is the center of mass of the body and everything. The pelvis will always shift forward to stay underneath the head. As I always explain it to people, that's why you see the old guy posture where their head is way out, but their pelvis looks like they're jammed out and their knees are bent, right? Because the pelvis is always going to shift forward. So that's the same thing. If your pelvis is forward, it's the same thing as leaning back, right? So a pregnant woman, belly goes out forward, you lean back to compensate, you get lower back and hip pain. So a lot of lower back and hip pain too is actually caused because of a loss of curve in the neck, i.e. forward head posture.
So the gravity up in the front, it's causing the head to come back and up over the shoulders. It's also not talked about a lot, decreasing the curve in the mid back here. So with that forward head posture and the slumping, it'll cause her to come back, pull the shoulders back as well, and bring the head over the shoulders where it needs to be. The glasses coupled with that will keep you from really doing the wrong thing and giving into the weight and slumping down even further. But thank you. And important, and the reason why we do it at the end of the visits and with the vibration plate is we do the cervical traction first to get those cervical discs moving and start something called creep. It's just kind of a funny word to say that you're stretching the ligament a little bit more and allowing the segments around it to move a little more freely. Couple that with the wobble chair and it makes adjustments much easier, much less force needed to get things moving where they need to be. After everything's put in place, we give you the head weight and everything's nice and loose, everything's been, motion's been put back where it needs to be. 10 minutes on the vibration plate, increasing the effective gravity with the head weight is a phenomenal way to end your visits. But that's it for that one. If I've had patients in the past, and I don't have two, that can't tolerate the head weight at first. We can always tone down the weight, and same thing goes at home. We can't tone down the weight per se, or I don't think so, sit at home with less weight, but you can do less time. So if you're doing twice a day, 10 minutes, if you're doing 20 minutes, you can always tone that down to, I'd say twice a day, 10 minutes is a good place to start. But if you can't, 5 minutes is fine. It's like any other muscle. You kind of want to work your way up, to normal. Eventually, it won't be painful. 90 days is needed, though, according to the Pentagon protocol. And couple that with twice a week visits, 90 days, and phenomenal results according to the research. Last is blocking. So, not everyone gets these, but if you have significant pelvic tilt one way or the other, we'll send you home with a couple of these. They won't be this quality because they'd be way too expensive. But we'll send you home with some fun ones. And to kind of explain how they work, I need to talk about the pelvis and the hips. You have right and left and a sacrum in the middle. And the way the pelvis works, it's a diarthrodial joint, I believe. So it's got a covering here. I believe it's hyaline cartilage and another covering here inside the joint space on each side. And as you walk, if you pick up the right leg, the pelvis is coming, I'm over-exaggerating, about 4 degrees back. And then as you drop the leg and it trails, it comes forward. So they kind of work like this as we walk. If you have significant pelvic tilt, or I've seen 8 degrees, I'm sure they've seen more. If you have significant pelvic tilt back on one side, it'll appear on the x-ray lower, and it can actually be lower as well, but usually it's pulled this way. It'll pull the femur up as well, so the leg actually gets pulled up, and we can check them at the table. Usually it's a short leg, and we should address that with adjustments here. We usually start, I start with the low side, bringing that side up. Usually it's the side that needs the more rotation as well. So I add an extra rotation, and then other side, bringing that down. And if we send you home with blocks, if they're needed, if you had this side come back and this one go forward, we're going to need to block the top here, like this, and the bottom on the opposite side. So it's pretty much taking the rotation, if you think about the right coming back, and derotating to a block here and here. And I'm not going to get too much in detail with it because, like I said, not everyone needs it, but you can also block for something called a spondylolisthesis. So if you have your sacrum is a nice triangle-shaped bone, and you have the bottommost lumbar vertebra on top, and sometimes it'll slip forward through trauma, through lack of blood, lack of proper nerve flow. Tons of things can cause it, but if it starts slumping forward on top of sacrum, there's a way to block as well for that, which I thought was interesting. I did not know that. Patients can sit, put both blocks underneath them, and then bend their legs. It'll help encourage the body to kind of absorb that vertebra back in the space it needs to be. But it was interesting. Anything you want to add with any one of those therapies?
If we could just post edit add this section into the end of the glasses and the head weights. I do want to mention this, that separating the difference between the therapy glasses and the head weight as far as timing goes. Because with the head weights, you really can only take them for about 20 minutes before it becomes too much. The weight of your head is about 10 pounds, for the average person. So adding an extra 2 pounds, you're increasing the weight of your head by 20%, right? So that's a significant amount. So you don't want to exceed 20 minutes, because anything past that, you begin to basically overexert the neck, and now you stand the possibility of over exaggerating, and your neck starts to buckle, and now you're starting to do the opposite of what you're trying to do. You're creating an inhibition instead of a training exercise, right? So that's the problem with the head weight, is you're confined to only about 20 minutes of therapy, 3-4 times a day at the most, for most people is what they're going to do. But a lot of these, the benefits of therapy is the time factor. That's why a lot of therapies don't work, because they don't have the time factor in order to encourage it back into place. So think about braces, right? If a dentist put braces on your teeth, he left them on there for a day and then took them off, and you come back a week later and he put them on for a day and take them off, it wouldn't be very effective, right? You got to leave them on there 24/7. It's the time factor, and it still takes, years to change your teeth. So we battle that with therapy of how do we get enough time, and that's really going to come into play with the Posture Guardian too. But with the therapy glasses, giving credit where that's due, that was an advent of the Clear Institute. Dr. Dennis Wogan, he was the first one that I learned this trick from. And it's real simple, because when you have a loss of the curve, your head goes forward and down, right? So if you block out the top half of your eyes, you can't see, right? Because you're looking through the top half of your eyes. So it forces you can't really, extend back like this. Your ops button doesn't allow it. So what you do is that pullback comes from the lower cervicals. So you pull back here so that you can see underneath, and it brings the head up. But because they're lightweight, you can wear them as long as you want to. So we even tell people, if you're, have a pair of sunglasses, that you wear to the beach, stuff like that, put tape on the inside. People can't even see it. Then you can go to the beach and you can still be doing therapy, and it blocks out the sun, right? So it's like you get double benefit. But it allows you to do the therapies where the head weight and the therapy glasses you put on for the first 20 minutes with your Posture Guardian. Then you take the head weight off, but you leave those on as long as you can, right? So you can wear them, for 8-10 hours a day, as we have some people do. Make sense?
Just imagine wearing them out in public.
I'm not sitting down with it on. Do you sit with the head weight?
Not ideal. Yeah,
I don't think you mentioned that. So.
Yeah, sorry.
No.
Sit down in public.
Yeah, you want to be active. You want to be ideally in an active situation, because whenever you're stagnant and just sitting here, how hard is it to maintain your posture when you're sitting in these chairs, right? Even though, they're decent chairs, better than probably most, definitely better than wooden pews and stuff like that, but bleachers, right? But nonetheless, it's difficult, because fatigue sets in. So when you're active, though, your body is constantly adjusting, moving, you're retraining, as he said, those writing reflexes. You're training the body to act differently underneath that influence.
And you
Okay.
also want to make sure that the weight of your head weight is at the level of your eyebrows. You don't want it too high and pulling you forward down like this, so that it's evenly on your head so you can pull back.
Eating with the block.
I think you got it with blocks. As far as the for the spondylo, just getting that, what you're doing is getting that block underneath the wedge of the sacrum so that you're lifting the sacrum. So as you lift the sacrum, it pulls the lumbar spine apart, and that's how that vertebra drops down into the space.
You'll be using both blocks, right?
You can use just one.
Oh.
It's all you need is the tip of the sacrum underneath that block.
Sweet. Well, any questions at all?
All right.
Let's turn it over to the
Yep.
closer.
Okay, so we're going to go through two components. I'm going to go through the traction units, and I'm going to go through the posture guarding. So first of all, with the traction units, he mentioned proper warm up for getting your spine ready for the adjustment and how creep comes into play. What that really, I don't think I've heard this term yet, but what we're looking at is neuroelasticity and neuroplasticity. Those are two terms that basically, when you're in a neuroelastic state, it means that your spine is able to bounce back. Okay, so if you were in a car accident or you get hit by a football player, or something like that, hopefully it's just in football, right? Then as you take that impact, okay, thank goodness our spines are elastic, because we can take that impact and it bounces back and it doesn't suffer a permanent trauma right there. That's actually detrimental to making positive impacts on the spine, right? Because you take someone, and let's say you go into a chiropractic clinic, which is very common. You walk in the front door, you check in, you walk to the table, you get adjusted, you walk out, right? That's all that happens. There's no kind of warm up, no kind of therapy, nothing to prime the spine, okay? You're in a neuroelastic state. So once in a while, we'll get a patient come in and say, do I really have to do my warm ups? Well, you're cheating yourself if you don't, right? Because you're getting half an adjustment, basically. Because when you go through the repetitions, how do you go from neuroelasticity to neuroplasticity? Plastic bends, right? Plastic maintains its shape. So what that means is now the ligaments and the structures are actually able to be moved and altered. Okay, the way you do that is you have to fatigue the ligaments. You have to wear them out. And the only way you do that is by constant stretching, elongation, and contraction, right? Back and forth, very fast, right? What does that sound like? Wobble, right? Wobble, traction, vibration platforms, all of that stuff, the vibe plates, they go up and down on a very small scale, but very, very rapidly, all right? And so that elongation and shortening, what that does, that fatigues everything out. And so you're bringing yourself into that neuroplastic state. Now we can make the changes, and then we do what right afterwards? We put the head weight on you, we get you on the vibe plate for 10 minutes and have you stand there in that altered state while your spine cools back down and goes back into, a holding pattern, right? So we wear you out, fix it, then cool you back down into a holding pattern, right? That's how we're able to make those changes on a quicker pace, okay? So that's the same thing that we have with the traction units. Okay, with the traction units, the goal here is not to tear the wall off. Okay, I've been around for a little bit, and in my time at my old office, I remember one time somebody pulling so hard on those metal hooks, right? The ones that are thick, right? We had one of those, and someone pulled so hard that it straightened out the hook, and fell off and popped them in the forehead. We had another time that someone was pulling down so hard on the wooden blocks that it loosened it, and the next person that came to do it on there, unfortunately, she was the one to actually rip it off the wall, and a wooden block came off the wall and hit her in the forehead, right? So, things like that, that's not the objective of doing the traction. With the traction, you only need to stretch and relax, that's it. And we're going for the ligaments. This is not a muscular stretch, okay? A lot of times people look at this like, we're stretching before a soccer game or something. You're trying to tear everything apart, So we'll see the whole wall shaking sometimes. That's not what we're looking for. So when you get down into that stretch position, and if you don't mind, I'm going to have you. We're going to get you in position here, okay? So. Okay, so what you're going to do is, once you get in position, okay, you want to get it tight enough to where basically the up position is already at a little bit of a stretch, okay? You shouldn't be here, right, to where you're completely no lax, because then what happens? You have to drop way down to get into that stretch point. So you should be where it's already a little bit tight, and then all it takes is just a little bit of a drop of the knee. So even if you have bad knees, it really shouldn't be that big of an exercise, right? You're not really making a whole lot of bend at the knee if doing it correctly, okay? Now, the next thing you'll notice is the position of the bar. And I'm going to talk about this a little bit more, but we won't have her stand here while I'm going through all that. Okay. The position of the bar, you'll see, I do want them to see this for the camera. So let's shift this way. Okay. Here's what I want you to notice. See the pull of the rope here. Okay. And the angle of pull here. If we were to take this and we rotate it like this, okay, do you see how this rope is now pulling at the level of her atlas? Okay, there's a major reason for this, okay, but as we rotate this down, okay, the angle, these pivot points here lower down, and so now it's pulling into the lower cervicals, okay? This is critically important, so thank you. Here's why that's so important. These traction units have been in use, not these ones, but traction units, repetitive cervical traction units have been in use in chiropractic for, years, decades. I mean, they were there long before I've been around, right? And they have a straight bar. And for someone that has a normal curve that already, can bend pretty well, they were always very uncomfortable. It always felt like it was jamming into my upper cervicals. And I kind of felt like I knew what was going on, but there was no way to really, we couldn't really prove it. Then when we got the digital motion x-ray, we tied a rope to the rafters, literally up in the ceiling, and dropped it down through the ceiling so that we could mount a traction unit in front of the DMX. Okay, so what does that allow us to do? Then we can watch people in real time doing the traction. And so took all different kinds of necks, right, attached to people, of course, and had them drop down and watch what's happening in the curve. And sure enough, guess what's happening? That pull, because it's so high with that flat bar, it was pulling the atlas forward. Well, guess what that does? Forward head posture. You're driving the upper cervicals that way. This is what that looks like, right? So it's creating forward head posture. So ironically, the thing that we've been using for decades to fix cervical curve issues was actually causing some of those problems too. Okay, so how do we fix that issue? We got to get the angle of pull to the right place. Well, we do that by lowering that pivot point. So we just curve the bar and problem solved. Okay, we get exactly what we're looking for, and sure enough, we test it on DMX, perfect. So that solved that issue. That's why you see the curved bars that you, as of right now, won't see anywhere else. But hopefully that will be a norm in the future. Okay. So does anybody have any questions on the traction? Any additions on the traction? With wellness patients, we do 30 repetitions. On corrective patients, we do 100 repetitions. Is that right? They do all the training, so I have to get refreshed on it.
And then it's not going to be one like this, right? It's going to be one that goes over the door.
Yes, good point. Yeah, so here, you guys probably at home don't have the luxury of putting steel rails onto your walls. At least, I probably wouldn't suggest it. Maybe the garage, right? But at home, they have basically a catch, a plastic tube on the top that you throw over your door. And so you can still adjust the height of it and everything to get it right for you, and I would definitely encourage you to do that. But here's one note, okay? If the door opens towards you, it's not going to work, okay? Because as you're pulling down, one of two things is going to happen. Either one, you're going to pull the door open and it's going to pop you in the forehead because it's going to fly off. Or two, you're going to end up permanently deforming your door until it falls off and pops you, right? So don't do it that way. You want to do it with the door pulling into you. That way, as you're pulling down, you're shutting the door. Does that make sense? Okay. All right. Good point.
Also, don't stand on anything.
Don't stand on anything? Yeah, don't. Great point. Don't stand on a stool to get to it.
Oh,
Guys, all of these
Or your
things
wobble cushion.
are because they've happened.
Or your wobble cushion.
Yes, people have, all of these stories, people have done them. We've We've seen it all. Watch your kids. Don't let them do backflips up the wall off of them. They're not designed to hold 80 pounds of leverage. Yeah, all of this stuff comes into play.
And we're doing this twice a day, right?
Twice a day, but you can do it more. Don't do it all day, but you can do it 3-4 times a day. It's not going to cause you any problems at all. Okay? But again, it's just to the point of stretch. If you feel that little bit of stretch, you're good. That's all you need. You're not trying to rip your head off. Okay? All right, any other notes? Nope. Okay, Posture Guardian. Okay, you guys are actually this is the first time, in front of a crowd that we're calling it by that name. Okay? The Posture Guardian is finally patented, and it's trademarked, so I can call it out what it is now. And we've got the logo and the packaging getting ready for it and everything else. So it's about there. But we've been working on this. This is like phase. Well, this one isn't. This is probably the last phase. But we're on probably the third generation of the prototype. To get it to where it really is now. Okay. But what is this for? Okay. You guys have seen almost assuredly on Amazon, or the other shopping platforms where they have these posture devices called like angel wings and stuff like that. That's like a figure 8, right? Somebody asked me about it today. They said, "Hey, I've got one of these things that pulls your your shoulders back. Will that work?" And the problem is while yes, it does pull your shoulders back, it kind of works like a backpack. As you turn to the side, look at what happens to my head, right? You just pull the shoulders back, your head tends to go forward. That's a problem. So they don't really work that great. What you want is something that's pulling down simultaneously at the lower part of the cervical spine, through the upper part of the lumbar spine, and retracting the shoulders at the same time. You've got to hit those 4 points to really make it work. And so it took some time, figuring out how exactly to do that, but we got it to the point where you can do that, but it's also comfortable and it's flexible, so the first generation was solid nylon and so it didn't flex at all. So, you're like walking around like this, you fall down, you've got nothing, you're going down. Like, you better have strong forearms because that's all you got, right? People would say, "Can I drive with it?" No, not at all. But honestly, with this one, you could drive with it. It's probably not going to cause any problem at all because it allows you to fully move. People run in it. They go to the gym with it. They walk their dog with it. They do yoga. All kinds of stuff with it. People sleep with them on.
No.
Yeah, I've heard all of that. I'm not telling stories. I've heard all of that.
With it on.
As long as they sleep on their back, it's probably not that big of a deal.
But then they have their cervical roll.
Can you drive it?
They probably didn't have their cervical roll in. Am I going to say you can drive with it and put my stamp of approval on it? No, I don't think legally I should do that.
No.
But can I say that people have done it? Yes. Patients have done it, and
My concern
they
with
seem
that
to not
though
have.
is
The
those car
movement.
seats roll your pelvis right back, and so you're just working against, you're fighting the posture guardian the whole time.
And there's not really much point either.
Yeah.
Even though,
Because
people
you're like
are
this.
comfortable doing it, there's not much point because you're sitting in a bucket seat with your head forward, grabbing the steering wheel. And you're sitting in the same spot. It's not an active exercise. Again, this works best when you're active. If you're, wearing your posture guardian 8 hours a day, that's great. Until I find out that you're sitting in a lazy boy that 8 hours, right? Then it's like, okay, well, that doesn't really make any sense at all. Okay, so as far as putting it on, Danielle is going to show you how to put it on. Okay, and you kind of put it on like a backpack, right? So one shoulder around the neck, other shoulder through, and then you pull it taut in the front, clip it into place, and then it makes it real easy with the pull tabs in the front that you can tighten it up to where it needs to be. Okay? Now, here's the cool thing about it. It doesn't have to be super tight. Okay? it's meant to be a subtle reminder, a subtle force. If you pull it too tight, what's going to happen anyways? You're going to be in the weirdest position, right? But you just want that subtle force. See, is going into the back of the neck. That's point 1. Point 2, you got the 2 fronts of the shoulders. Point 3, it's crossing over the 2 bands right into the upper lumbar spine, pulling them forward. So you're literally pulling the spine into the perfect position. And I'm not saying perfect like the sleep bed ads, that we were talking about, where it shows a straight line, yet the person is like this in the bed, with their head on the pillow. It literally puts you into the right position. And as you can see when she does jumping jacks and yoga right now, I'm just joking. It's perfectly comfortable. You can do everything that you need to do in it, and it's no problem whatsoever. So it allows you to get that time, because remember, we talked about the time factor. Time is huge. You can't replace time. If you only wore this for, again, we get all of this stuff with patients. You ask them, how much are you doing on home therapy? And they'll say, oh yeah, I'm doing it every day. How much time with your posture trainer? Oh, I get about 15 minutes. I mean, it's not really going to do anything in 15 minutes, because you really haven't even had time to accustom to it in 15 minutes. We used to say, wear it for 1 to 2 hours. You can keep it on or take it off, however you'd
I'm gonna
like.
drive home with it on.
You can show everybody that is perfectly fine to
I'm
sit
gonna go to
in.
sleep with it on.
Yeah. So we used to say initially 1 to 2 hours. That was underestimated, right? 1 to 2 hours was good, and it is. And still we say 2 hours is kind of like the expected minimum. Okay, it really needs that much time to get the most benefit out of it. Until I had a patient that I got a x-ray on. It was her first re-x-ray. So we're talking 6 weeks in to care, 12 adjustments in, and she went from a reversal in the cervical curve to a completely normal curve in 6 weeks. And I was like, what happened? Okay, I knew we were on to something, but what happened? Like, I got to know what you did. And so we sat here and talked about it, and sure enough, found out that I had written a note for her. She asked if she could wear it to work, and said that she needed a doctor's note to be able to wear it at work. Well, I just signed it like no big deal. Yeah, you can wear it to work. That's fine. Forklift operator, no problem. No, I'm just joking.
Okay.
No, she just worked retail, right? And so she, not a stamp of approval to wear while a forklift operator. You can get sued for anything these days. So she got my note, and I just assumed that she was just going to wear it here and there at work. No, she took that to mean that I wanted her to wear it every day, all day at work. And so she was working 10-hour shifts 5 days a week. And so she was wearing it for 50 hours a week, right? And that's how it happened. And so I was like, epiphany moment, okay, well, we're not doing it enough, right? People need to wear it more. The more you wear it, the faster you're going to see the results. So if you're at 15 minutes, you got to get up to 2 hours. If you're at 2 hours, you got to get up to 4, 6, or 8 hours, right? Wear it longer. The longer you wear it, the more benefit you're going to get from it. Now, there is, just like the neck roll, an acclimation period, okay? Meaning that if you just try to do that right away, you're probably going to overdo it. You're probably going to be really sore if you wear it for 10 hours the first day you get it, right? Work your way up to it. Start with like half an hour, then go to an hour, then 2 hours, then 3 hours. Work your way up to it as you're able and get used to it, okay? We don't want you to just like the head weight, you can overdo it with any of these. You can drink too much water, right? So I think that's everything, as far as time and everything.
I got a
What else
question
you
about
got?
The
Yeah.
other posture trainers that you see on Amazon, the square pad, stretch, the shock, they pull you up, pull you back. You seen this?
There's supposed to be a
It's like
reminder.
neurofeedback.
It like
Yeah.
buzzes you when you start slipping. So
I don't think it shocks you. I think it's a vibration.
Do they give you a complimentary prescription for antidepressants?
no.
No? Well, then I probably wouldn't get it.
I always get asked that though. They give us like
Yeah.
3 or 4 times about the one that shocks you and pulls you up for the kid.
I know which ones you're and they're like, everything's into, you got to have an app for it. If it doesn't have an app, it's not tech, right? So, the ones in it, it's got like an inclinometer in it that reads if it's upright or forward, and if you slump forward too far, it it dings you on your phone or shocks you, depending on the model that you get, right?
I was just
Yeah, the problem is all that's going to do is get you to do this. But, you can pull your shoulders upright and stick your head forward, right? It can, it doesn't have anything to do with that. So you're really only training one thing, and that's the tilt of your thoracic spine. That's about it. It's, and secondarily, it really becomes an active participant thing, right? When you're wearing it, you're an active participant. We want you to be passive. We want you to, wearing braces is a passive therapy. You don't have to think about it. It's working 24/7 around the clock. It's doing what it's supposed to do. Same thing, the posture trainer, posture guardian, it's a passive therapy. You put it on and you don't have to think about what it's doing. It's causing you to do what you need to do at all 4 points, right? So, good question. Yes?
Would you recommend wearing that with also the head weight at the same time, doing those at the same time?
Great question, yes. So the protocol is you want to put your head weight on, your posture guardian, and your therapy glasses for 20 minutes together. Then after 20 minutes, what do? Take off the head weight and you leave on the glasses and the posture guardian and wear those as long as you can. Yep.
after the wobble and the cervical.
Yep.
And I do want to point out one thing. A lot of the issue with posture now is that, like Dr. Jordan mentioned, we have relearned our new normal. And when we have forward head posture especially, but
We don't use those words here.
Yeah.
excuse me. So you have negative movement patterns trained into your body. What happens is our shoulders roll forward, and that shortens the pec muscles, and then it lengthens the rhomboids and lower traps in the back. And so these postural muscles don't know how to hold us upright in a good posture. One thing I've found with the posture guardian is that if you do a little pec stretch before, it's easier to wear it for a little longer when you're getting started. So a pec stretch, you'll stretch at the horizontal, and then stretch above to stretch the lower pec muscles, and then below to stretch the upper branch. And if you do that just for a couple quick seconds before you put your posture guardian on, maybe you can make it more than 30 minutes the first couple of times you wear it.
And that strikes another chord with another neurological reflex, right? It's called Brugger's posture, that you can do to open up your posture, and really this is a quick reset any time of the day. It's a great reset any time of the day, where you put your feet shoulder width apart, toes straight forward, okay? Take your hands, turn your thumbs out, okay? It's great to do this against a wall, and then you pull your chin back, okay? What you're doing in that position is you're activating all of your extensor muscles, okay? And because of reciprocal inhibition, what that means is you are turning off all of your flexion muscles, right? All your flexion muscles are the ones that turn your hands in and your head and everything down this way, right? Even when doing the wobble chair, you tend to, as you go forward, naturally your hands want to come in, okay? As you extend out, right, your hands tend to want to go out. So that's just a really quick, easy reset where you hold that position and hold it for about 30 to 60 seconds, okay? And what it does with that reset, you're turning off all those flexion muscles, and it really does reset the posture. If you're real tight and you just feel like you just can't get out of this position and you're like getting tired and everything, you do that stretch, it resets everything neurologically, and you'll feel revitalized after doing it.
Can you go over foot placement when you do the cervical traction? Because some patients will stand with their feet really close together, and it buckles their knees in. So will you just talk about
Okay. Yeah.
Yeah.
So, when doing it, it's, of course, you want to make sure that you're close enough to the wall that you're not being pulled towards it, but you don't want to be right up on the wall either, okay? Especially not to the point where you're rubbing paint off the wall, right? Somebody's nose got the paint over there, I don't know. So if you're, if your toes are close together and in, you don't want your knees bending in this way is what she's saying. Same thing, you don't want your feet out, and your knees are bending out that way, or you're sticking your butt out, or some people are going like this and they're sticking their pelvis in, okay? It should be a straight drop down, okay? So feet, again, shoulder width apart. What you're doing is basically a squat, okay? So in a squat, you're dropping straight down, body straight down, and your butt's going towards your heels, right? And then straight back up. But, it's not as easy to do that with your toes pointed out or your toes pointed in, right? You can't, especially you can't get down that way. So it should be in that same position as a squat, feet shoulder width apart, toes forward. And you're going to be probably half of your foot distance from the wall or so, to be in the right position. If you're out here, you're going to have a hard time, right? Any other questions? Nope. All right. Thank you, guys. If you have any questions afterwards or anything, let us know. If there's any questions from the videos, of course, post them in the comments. We'll be more than happy to help you and answer those questions. But outside of that, thank you all for coming and participating. Thank you for our demonstrators. And we will see you guys at the next.
Thank you.
Absolutely.